Okay, so this is our last topic for parasitology finals. And this is about trematodes. So trematodes, other name for them is fluke. So these are also known as flukes. Si cestodes, di ba, if you remember, yung sa structure niya, these are flat. Okay? Kaya ang tawag din sa kanila is tapeworms. Kasi parang tape siya na flat. Tapeworm-like. Okay? Cestodes, tapeworm, trematodes, fluke. So as you can see here, we have, what do you call this one? Wait, ano lang ako? Sa highlighter. Okay, so we have here different types of eggs under trematodes. Okay, so yung mga yan. But this one, this is an adult. Okay, and the others, these are eggs. Okay, so, here, if you remember, in cestodes, merong black sheep doon kasi may naiiba, right? In trematodes, okay, so the following are the general characteristic, pero meron na namang except. Okay, may pa-black sheep, may pa-importante, may papansin. Okay? So, yung papansin na yon, these are the blood flukes. So, what are the blood flukes? So, these are the schistosoma species. Schistosoma that we will be covering are Japonicum, Hematobium, and Mansoni. Okay? So, what are the general characteristics ng trematodes? They are also flat. Okay? Kaya nga, generally, for platyhelminthes, cestodes, trematodes, these are flatworms. Okay? Mga flatworms sila. But, si tapeworms, si cestodes natin, tape-like siya. Mahaba na flat. Dito naman, flat pero maliit lang. When it comes to the size, it is smaller, it is shorter, para lang siyang dahon. Okay? Kaya nga, yung general characteristic is that flat and leaf-like in structure except blood flukes. Okay? Kasi sa blood flukes, they are not leaf-like, they are not flat. Kasi para silang, what do you call this one? Round worms. Okay? Though they are not perfectly round, pero these are worms. Okay? Hindi sila flat and leaf-like. Hermaphroditic din sila. Okay? So, a single worm, a single parasite, okay, contains testes and ovaries, just like si cestodes. Okay? So, pareho silang hermaphroditic ni cestodes, except na naman di papansin which are the blood flukes or the schistosoma. Okay? Eggs are operculated. Okay, so they have an opening where the larvae exits. Okay, so meron siyang operculum. So if that's the egg, meron siyang operculum na ganyan. So in cestodes, meron lang tayong isa doon na operculated, which is si Diphyllobotrium. Okay, so si Diphyllobotrium. And then, but an exempt to this operculated is that si blood flukes, wala silang operculum. Okay? So sa cestodes, wala silang operculum except si Diphyllobotrium. Kay trematodes naman, eggs ng trematodes are operculated, pero si blood flukes, they are not operculated. Okay? Yung eggs ng blood flukes, they are not operculated. Here, the infective stage is metacercariae. Okay? Except blood fluke. Di papansin. Ano ang infective stage ni blood fluke? Cercariae. Ito lang, wala siyang meta. It's cercariae only. Requires two intermediate hosts except blood flukes. Ilan ang intermediate host ni blood flukes? Isa lang. Okay? So, very papansin siya. Okay? So, schistosoma, isa lang ang kanilang intermediate host. Okay? So, this one, pare-pareho na sila with blood flukes. These are multicellular eukaryotic helminths. Okay? So, hindi siya kagaya ng protozoan. Kasi di ba si protozoan, although not all yung mga intamibas natin, these are single structures only, single cell. Pero itong mga trematodes, cestodes, nematodes, lahat silang multicellular. It attached to host cell by means of two suckers. So yung mga flatworms natin, meron silang suckers which they utilize in attaching to the host cell. The difference is that kapag si cestodes, merong four. Four suckers kay cestodes. Okay? Si cestodes. Pero si trematodes, ilan kay trematodes? Dalawa yung kanilang sucker. Okay? So, life cycle, egg, stage, larva, and adult. So, again, these are hermaphroditic monoecious. Okay? Monoecious or hermaphroditic, a single adult contains the female and male reproductive organ. So, nagsi-self-fertilization siya. Okay? Nagsasarili. Kumbaga, nagsasarili. Except, again, si schistosoma species which are dioecious. Kailangang separate ang male, separate ang female. So, magkaibang parasite. Okay? Eggs mature when laid. Okay? So, CCHOS. Okay, so CHOS, Clinarchis, Heterophyes, Opistorchis, and ano na yung S? Wait lang, check ko. So that is schistosoma. Eggs mature when laid, Clonorchis, Heterophyes, Opistorchis, schistosoma. Immature, eggs are immature when laid, that is Paragonimus, Echinostoma, and Rayletina garzoni. O, diba? Social. Okay, so we have here yung intermediate host. First intermediate host nila ay snail. Okay? But then again, si schistosoma isa lang ang kanyang intermediate host, which is also a snail. Okay? So, pare-pareho yung snail ang kanilang intermediate host. Saan sila nagkakaiba-iba sa second intermediate host? Pag fish, ang second intermediate host, that is for Heterophyes, Heterophyes. Kapag crab, it's Paragonimus, Westermani. Pag plant vegetation, okay, dito naman sa snail, this is, kapag first lang, it's schistosoma, that is Oncomelania quadrasi. O, diba? Oncomelania quadrasi. Sa plant vegetation, ito na yung mga nag-start ng F. Fasciola hepatica, Fasciola gigantica, and Fasciolopsis busci. Kapag ang second intermediate host is another snail, that is Echinostoma elucanum. Okay, mode of transmission. This is for schistosoma. Okay, so this is given off by the infective snail. So the mode of transmission for schistosoma, that is penetration of skin. Okay? Skin penetration, that is in yung mga lakes, okay? Or yung mga farmers, ganyan. Kasi nga, the cercariae, nagsuswim. Hindi siya sa soil, okay? So, sa ano siya? Sa water bodies. Kasi it has a cercariae wherein it is capable of swimming. Okay? Metacercariae, this is the infective stage of other trematodes. Schistosoma, not schistosoma kasi for schistosoma that is cercariae. Okay? So, yung iba, Paragonimus, Echinostoma, Rayletina garzoni, Fasciola hepatica, Fasciolopsis busci. So, yon metacercariae. So, that is an insisted form of cercariae. So, saan to nakikita? Siyempre, dun sa mga na-mention natin na second intermediate host. Okay? Sa plants, water, fish, crustacean, and animals. So, we have here classification of trematodes according to their habitat. Okay? So, eto madali lang tong bloodstream. Siyempre, nandiyan na yung ating schistosoma. Salang, that is Paragonimus. Okay? So, eto, we will go over them. Okay? So, eto na lang muna for this slide. I want you to remember, eto lang muna. So, as we go on, we will answer this one. As we go on, pag lungs, Paragonimus westermani. Pag bloodstream, it's schistosoma. So, siya yung naiiba, si Paragonimus. Okay? That's why kapag sputum sample, meron kang nakitang parasitic-like structure or parasite found in the sputum, okay, hindi ka na mag-iisip. Si Paragonimus na. Okay? But take note also, may mga other, just like yung capable of lung migration, yon. Pwede din sila sa lungs. Okay? Pero usually, if yung question is about sputum, merong operculated or parasitic-like structure ng trematode that is Paragonimus. Infection with Paragonimus westermani can also be confused with tuberculosis. Okay? TB, Paragonimus. Take note ha, it's not Paragonimus westermani that can cause tuberculosis, but infection with Paragonimus westermani can be confused with tuberculosis. Okay? Pwedeng ma-confuse yung clinician na instead na isipin nila that is Paragonimus westermani infection, nako-confuse sila dun sa tuberculosis infection. Okay? So we'll discuss first the blood flux, Japonicum, Mansonii, Hematobium. In other books, it's not HAE, it's HE. Parang yung sa hemoglobin. In some book, it's HAE. In other books, it's HE. So, pwede lang din. Schistosoma japonicum, Mansonii, and Hematobium. Schistosoma japonicum, Oriental blood fluke. Other name, Oriental blood fluke. Kaya hinighlight yung O. Okay? Sa Schistosoma mansonii, Manson's blood fluke. Okay? Manson's blood fluke. And then Hematobium, vesicle blood fluke. Okay? Vesicle blood fluke. So, we go to their general morphology. Okay? So, ano ang kanilang general morphology? Difference from other nematodes, they shows they are not hermaphroditic. Ibig sabihin, iba yung adult female worm, iba yung adult male worm. Hindi kagaya ng ibang trematodes, nagsi-self-fertilization sila kasi hermaphrodite sila. So, nag-e-enjoy tong ating mga schistosoma, di ba? So, non-operculated ang kanilang eggs. Take note. Baliktad sa cestodes, okay, all are non-operculated except Diphyllobotrium. Sa trematodes naman, it's the other way around. All trematode egg are operculated except Schistosoma species. Okay? So regardless kung Japonicum, Mansonii, or Hematobium yan, non-operculated ang kanilang egg. So yung kanilang cercaria, this is bifurcated or fork. Okay, so I want to show you yung fork. Maswerte kayo kasi may mga PowerPoint presentation. Ngayon, before, during our time, wala. Ni-imagine lang namin yung mga yan. Yan yung ibig sabihin ng fork-like structure. Okay, bifurcated. Meron siya ito. That's why it's capable also of swimming. Okay, eto yung kanyang head. That is this is a cercaria. Okay? So, balikan natin. Saan na tayo? Schistosoma. Okay? So, adults parasitize blood vessels. That's why they are termed as blood flukes. Flukes residing in blood vessels. So, anong other term niya? Anong other name? O, Oriental blood fluke. Ano ang intermediate host? Oncomelania snails. Okay, ano ang definitive host niya? Domestic animals. Okay? Schistosoma japonicum. Usually, this is the case, di ba? Male is smaller but sturdier sex than female with oral and ventral sucker. Okay, with two parallel guts. So, ayan mo na yan. One row, it has a presence of gynecophoral canal. For what is this gynecophoral canal? The gynecophoral canal in male, okay, is where the female repose. Okay? Kung saan siya nag-i-stay. Kasi dito, they are sweet. Okay? So, they are very romantic parasite. Why? Okay? Kasi lagi silang magkasama usually or ganyan, no? So, this is the gynecophoral canal. Okay? It is where the female schistosoma resides kapag nagkakaroon sila ng copulation. Okay? So, yan. So, nandyan lang siya. It is held by the male parasite. Okay? So, yun yung gynecophoral canal. It has incomplete digestive system with excretory system. So, if you remember yung ating mga cestodes, wala silang digestive system. Di ba? Kasi nga, they absorb the nutrients in the small intestine. Okay? Eto, meron silang digestive system. However, it is incomplete. Okay? Yung excretory system ng ating mga trematodes, meron silang flame cells. Social. Okay? Excretory system contains flame cells. Okay, flame cells. Worms ingest RBC and with protease or hemoglobinase that breaks down hemoglobin and globin chain. Okay? So, meron daw silang protease which is capable of breaking the red blood cell into the breaking the red blood cell and breaking the hemoglobin to yield heme and globin chain. Meron din silang oral sucker. Okay, and meron ding ventral sucker. Ito yun, yung vitellaria, okay, sa flame cells. Meron silang gynecophoral canal. Siyempre, yung lalaki yung may gynecophoral canal because that will help the female when they are having copulation. Okay, napaka-sweet naman. Ano yun, hinahag, di ba? So, eto, mas mataba kasi nga yung presence ng gynecophoral canal. Ito yung female structure. But this is for schistosoma mansoni. Okay? So, eto, sinabi na natin, female. Yun nga, nag-i-stay siya sa gynecophoral canal because the male held it. Okay? Kinakarga niya when they are having copulation. Okay, we go to the ova characteristic ng oriental blood flow, schistosoma japonicum. Ovoidal, rounded, or pear-shaped. Sa kanilang tatlo, siya lang yung pear-shaped and ovoidal. Okay? Siya lang yung pear-shaped and ovoidal. Okay. Meron siyang small lateral spine. Take note, small lateral spine is often seen or may appear as small hook or knob located in the depression of the shell. So, asaan na yun? Ito. Okay? Mali lang yung pinoint ng arrow. Pero baka na-move kasi yung picture. Okay? So, if you see that one, okay? So, for you to remember, not to discriminate naman, okay? So, according to studies, di ba, pag ocean, yung kanilang penis is mas maliit as compared to other. Okay? So, eto, nire-represent ng Japan, kaya small. Okay? So, yun yung iisipin nyo, ay, small. Okay, Asian, Japan, Japonicum. Okay? Small lateral spine. Okay? Ang daming iniisip ni ma'am. Okay? We relate it for you to, remember this in longer term. Okay? So, wag yun na ibigay yung recording ko sa iba kasi mamaya ma-issue ako. Okay? So, we have here schistosoma mansoni. Okay? Man, tao. Okay? Man, lalaki. Elongated with prominent lateral spine. Okay? Near posterior end. Anterior end tapered and slightly curved. Okay, eto, ay aba, mahaba na siya, lalaki. Okay? Sino ba yung may mahabang structure sa baba? Siyempre, lalaki. Mansonite. Okay? Prominent. Kitang-kita. Prominent lateral spine. Okay? Ovoidal, small lateral knob. That is Japonicum. Prominent lateral spine, Mansonite. Okay? So, nakikita nyo naman wala silang operculum. Walang operculum. Okay. Ito naman, schistosoma hematobium. Schistosoma hematobium, elongated with rounded anterior and terminal spine. Okay? Terminal spine. Ako naman yung iniisip ko dito is what? Tumae. Okay? Tumae ng dugo. Okay? Nakatae ng dugo. So, yun. Ito na susulat. Okay? Basta nakatae ng dugo. Okay? So, nakatae ng dugo, nasaan? Hematobium sa may puwet. Okay? So, parang sa puwet siya ng itlog, ng egg ng hematobium. Okay? Nakatae ng dugo. Okay? Sa nakatae, syempre sa puwet area, kaya ito as in, sa posterior end. 'Di ba? Okay? And then, yun nga, tae ng dugo, tae, hematobium, hemoglobin. Okay? So, eto man, okay, prominent lateral spine. Okay, lalaki, may mahaba. Okay, naka-side view si kuya. Okay? Eto naman, Japan, ay Asian, maliit. Okay? Small lateral na. Okay, I hope that helps you. Okay, based on that, let's go with this structure. Okay, how about this one? Okay, ay sa puwet nakatain ng dugo, hematobium. Eto, how about this one? Ay side view lalaki to. Okay, naka-side view ng lalaki. Merong malaking patulis na structure. This is what? Man. Okay, lalaki, man, sunay. Okay, how about this one? Ay, maliit lang. Small lateral lang. Okay, Asian to Asian. Okay, so this is Japan, Japonicum. Okay, so how about this one? Okay, prominent lateral spine pa rin. Okay, so lateral, mahaba, prominent, lalaki, man. Gets? Okay, hope that helps. Miracidium. So this is apical papillae, epidermal plates covered with cilia. This is also a stage ng mga trematodes. Okay? Pair of cephalic unicellular penetration glands. Meron silang flame cells. Ano ulit yung sa flame cells? For excretory system. Okay? Excretory ang flame cells. Phototactic and swim actively in surface of water. So, yan si Miracidium, that is the structure. Si Cercariae is simple lang siya. Meron siyang head, meron siyang body, and meron siyang bifurcated tail. Fork-like structure. Fork tail. Okay? So, eto naman yung sa Miracidium. Okay? So, Cercariae, eto na nga yung ating Cercariae, elongated body. So, this is the elongated body. Fork tail. Yan. So, fork tail. Tail trunk. Fork has an oral sucker anterior part of the body. Okay? So, pathogenesis and clinical manifestation. Quantum of Cercariae that infect the host determines the severity of infection. Possible na magkaroon ng host granulomatous reaction. This is the main pathology of disease of Schistosoma japonica or due to host granulomatous reaction to eggs deposited in the liver and other organs. So if the female adult worm, okay, deposit eggs, nagkakaroon ng host granulomatous reaction yung individual. Okay, so this is for Schistosoma japonica. Presence of superficial lung PPK, pneumonitis, granulomatous hypersensitivity reaction, granuloma, and obstruction of intrahepatic portal branches. Okay? So, the obstruction of intrahepatic portal branches, saan to? Sa liver yan, di ba? This is the most serious consequence of granuloma formation ng liver. Pag nagkakaroon ng granulomatous hypersensitivity sa liver, ang serious consequence niya is obstruction of intrahepatic portal branches. Okay, clinical aspect courses of infection divided into 3 progressive stages. Of course, first dyan ang incubation, and then period of early egg deposition, and then period of tissue proliferation. Okay? So, egg deposition, magde-deposit na siya ng egg, and then magkakaroon na ng reaction sa ating tissues. Okay? So, sa incubation, kasama dyan yung cercarial penetration of schistosoma migration, okay, sa maturation ng ating mga flukes. Okay? If you remember, meron pa tayong isang parasite that can be acquired through skin penetration, and that is hookworms, di ba? Skin penetration, the difference is that yung skin penetration happens in the soil, but here skin penetration for the schistosoma happens in water bodies. Okay? Kasi nga yung intermediate host niya, 'di ba, that is snail. So, saan ba yung ating snail? Siyempre sa mga water bodies. So, they release the cercariae. The cercariae can swim. Okay? And then, it penetrates the skin. Kaya ang tawag sa skin penetration at the site of infection, that is swimmer's itch. Okay? Swimmer's itch yung tawag. Pero kapag mga hookworm, anong tawag? Ground itch. Okay? Itching. Ground itch, hookworm, swimmer's itch sa mga schistosoma. Okay? Colonic schistomiasis, this is associated with malignancies, results to dysentery and diarrhea. Kapag hepatosplenic schistosomiasis, yun na, most serious consequence ng chronic schistosomiasis. Pulmonary schistosomiasis, nagkakaroon na ng larvae migration, pulmonary, syempre sa lungs na yan, with principal manifestation of cold pulmonale, resulting from the obstruction of pulmonary vasculature due to granuloma formation and subsequent fibrosis. Cerebral, syempre meron na diyang involvement ng um, what do you call this one, ng nervous system. Cerebral, the nervous system, particularly na sa spinal nerve. Brought about by parasite transition from the vein, pupunta na siya ng spinal nerve. Kaya involved na yung nervous system, cerebral schistosomiasis. This complication may occur during episodes of Katayama fever or chronic stage. So, pag naririnig nyo na tong Katayama fever, yan, and this is associated ng parasite, the first thing that must come into your mind is yung schistosoma. Okay? Col pulmonale, this is abnormal enlargement of the right side of the heart as a result of disease of the lungs or the pulmonary blood vessels. Okay? So, yun na, enlargement of the right side of the heart. Okay, pathogenesis, pag Mansonii, sorry for this, it should be small letter, Schistosoma mansonii. Again, lalaki, prominent lateral spine, hematobium, nakatain ng dugo, okay, terminal spine, okay, sa puwet. So, take note, ito yung medyo kakaiba, why? The sample for hematobium is urine. If you want, if, what do you call this one? Diagnosis is made, okay, yung schistosoma egg, so that is yung may terminal spine na sa urine siya. Why? Kasi the hematobium resides on the veins of the bladder. Siyempre, pag veins of the bladder yan, hindi yan lalabas sa tae, kundi lalabas siya sa ihe, yung eggs. Okay? Urine ang, so this is urine. Urine. Sa urine po siya. Okay? Most pathogenic Mansonii site of infection, veins of the large intestine. Okay? So, ganun ulit. You relate this one, di ba? Mansonii, prominent lateral spine, malaki. So, saan yung infection? Veins ng malaking intestine. Okay? Japonicum. Okay? High morbidity, site of infection, veins ng small intestine. So, i-relate mo na naman to sa kanyang egg para mas maalala mo siya. Okay. Small lateral knob or small lateral spine. Pero it's usually yung knob kasi hindi siya patusok, di ba? So, small. So, alalahanin nyo na lang din yung egg. Maaalala nyo na large intestine, malaki, Mansonii. Japonicum, maliit, small intestine. Okay, clinical symptoms, migratory phase, wala pang symptoms siya, symptomatic. Acute phase, also known as Katayama fever, may chills, fatigue, headache, and others. Presence of hepatosplenomegaly. Nung ibig sabihin yan, enlargement of liver and spleen. Okay? Hepatomegaly, enlargement of liver, splenomegaly, enlargement of spleen. So, combination na to ng liver and spleen, enlargement of both liver and spleen. Chronic phase, nagkakaroon ng bloody diarrhea. Okay? Enlargement of liver and spleen, hepatosplenomegaly, as sites bloody urine, ito for what? schistosoma hematobium. Okay? Associated din, pwedeng mag-develop into cancer, kidney problem, and CNS lesion. Okay? So, infection of schistosoma, okay, pwede pa siyang mapalala because of that one. Okay, so dermatitis, yan, dermatitis or swimmer's itch yung term kapag that is caused by skin penetration ng cercaria. Penetration of cercaria. Okay? So, a patient with schistosoma japonicum has marked as sites. So, dito, enlargement ng spleen, umbilical hernia, eto, lumaki. Okay, parang protrude. And distended superficial abdominal veins. Yeah, saan ba yun? Parang eto. Okay? So, schistosoma. Okay, so we have here yung life cycle. So this is the life cycle. As you can see here, eto may nakalagay in urine. Okay, in urine. So also possible for what? For schistosoma japonicum. Kasi because of the arrow. Okay? Pero even feces, si urine pwede. Pero pag usually kapag mga hematobium, mas nauuna kasi siya nakikita sa urine structure. Okay, so number one, where is the number one here? So dito, presence of eggs. Okay. And then eggs hatch releasing miracidia. So this one, the miracidia. Miracidia penetrates snail tissue, which are the only intermediate host. Sporocyst in snail, okay, will develop into cercariae that is released by the snail into water and that is free swimming. The cercariae will then have a skin penetration, usually lower bodies, okay? Kaya there are cases ng ganito guys sa may Gonzaga, Cagayan. Okay, yung mga farmer, syempre nakababad yung mga yan sa fields, sa water fields pag nagtatanim ng palay. There are cases guys of this one in our country. Okay, so sa Cagayan, I think it's in Gonzaga. Cercariae lose tails during penetration. So yan, magkakaroon sila ng skin penetration, mawawala na yung ang kanyang tail. That will go to circulation because that is the habitat. That's why they are regarded as blood fluke. Large intestine, yung may malaki, lateral spine, Mansonae. Small intestine, yung Asian Japonicum Japan. Okay? Yung bladder, yung sa urine, that is hematobium. It migrate to portal blood in liver and mature into adults. Paired adult worms migrate to mesenteric venules of bowel or rectum, laying eggs to circulate to the liver and shed in the stools. Okay? And si letter C, nakalagay naman dyan, pag A to B, that is Mansonae and Japonicum. Pero si letter C, that is for hematobium, saan daw? Venous plexus of the bladder, okay, or veins ng bladder. So that is the life stages ng ating schistosoma. Okay? So, ayun, ulitin natin, Mansonae, large bowel, Japonicum, mesenteric veins ng small intestine, hematobium sa may bladder. Okay? So main points in the life cycle of schistosoma, they are residing in mesenteric vein. Definitive host is human. Okay? Intermediate host is the snail. Intermediate host, only one for each of the schistosoma species. Oncomelania hiponsis quadrasi or quadrasi, that is schistosoma japonicum. Kahit anong, hindi ko ito nakakalimutan why. I find the name of the snail very amusing. Oncomelania hiponsis quadrasis. It sounds so shallow to me. Okay, that is for Japonicum. Biomphalaria, it's Mansonae. Bulinus hematobium. Okay, Bulinus hematobium, Biomphalaria, Mansonae. Again, walang metacercaria, wala rin siyang regia stage. Ang kanyang infective stage, cercariae, route of infection, skin penetration. Okay? This is snail ng Oncomelania hiponsis quadrasi. Ma'am, what if, kinain ko siya? Okay? Usually, itong mga to naman niluluto. So, most likely, even if these are infected, you will not get the schistosomal Japonicum infection through ingestion because that is not the mode of transmission, right? It's skin penetration and not eating the snail containing the infected stage. Diagnosis, microscopic identification of eggs in stool or urine. Okay, these are the most practical stool examination techniques, the MIFC as well as si CATOCATS. Pwede din ang immunodiagnostic test, antibody and antigen detection, morphologic comparison with other intestinal parasites, as well as tissue biopsy. Okay? So, Schistosoma japonicum primarily a parasite of the portal vein and beats branches, thus the egg are not demonstrated in feces unless they are deposited in terminal vein or capillaries of intestinal mucosa or submucosa. Okay? So, yun lang. There's a problem usually kasi pag gagamit ka ng stool and urine. Okay? Kasi yung mga eggs nila, not usually pumupunta doon. It's not usual. Okay? So, stool examination is frequently negative even in active infection. Okay? Stool exam is frequently negative. Schistosome egg can be recovered in rectal or liver biopsy. Okay? So, kung talagang gusto, it's usually biopsy. Okay? Microscopic identification of eggs in stool or urine, that is the most practical. Okay? Yung MIFC, stool examination technique, that is not adequate for light infection. Pero kapag enumeration of eggs, epidemiological studies, and effect of control measure ang ginagamit dyan, diba? Usually, that's CATOCAT technique, CATOCATs. Okay? So, treatment, drug of choice, praziquantel. That is the drug of choice because it is effective in the treatment of all forms ng schistosomiasis with virtually no side effects. Okay? Control, no vaccination currently available. Contaminated water should be avoided. Control measures include sanitary disposal of sewage and destruction ng snails. Okay. So, lung fluke na tayo. Lung fluke sa lungs. That is Paragonimus westermani. Paragonimus westermani. So, we have here Paragonimus westermani egg, reddish brown and resembles coffee bean. Okay? Huwag kakalimutan to. Reddish brown, coffee bean. Okay? So, ang dami-daming nire-relate sa coffee bean. Kapag coffee bean shape, resembles coffee bean na parasite Paragonimus westermani egg. If coffee bean shape, bacteria Neisseria gonorrhoeae. Okay, Neisseria gonorrhoeae. Okay? So, there are other species ng Paragonimus that can cause yung infection of Paragonimus, but the most common species associated in our country is westermani, but there are other species as well like Paragonimus philippinensis, simensis. Okay, yung simensis sa cats naman siya. Yun nga, nasabi ko naman na I already mentioned, clinical manifestation is consistent with pulmonary tuberculosis. Okay, and infection with Paragonimus westermani is often misdiagnosed as pulmonary tuberculosis. Okay? So, testes are deeply lobed. Ito yung kanyang testes. So, but when it comes to the egg of Paragonimus westermani, you have to think of this one. It resembles coffee bean shape, reddish brown, and resembles coffee bean shape. Okay? So, has 6 long unbranched lobes, located anterior of testes. Okay, meron din siyang ventral sucker, oral sucker. Vitellaria are branch. Ito yung mga vitellaria. Yan. So, these are branch. Okay? So, Paragonimus westermani, ito yung very clear structure. Okay? Pero you can see also this type ng structure. Okay, ova characteristic. Ay, wait lang. Ako din na-confused na. Ito pala yung adult worm, guys. So, this is the adult worm. Okay, sorry for this. The parasite, this is reddish brown and resembles a coffee bean shape. Again, clarification, this is the adult worm. This is the egg. Okay? This is the egg ng Paragonimus westermani, oval, yellowish brown, large, thick, dark shell, prominent operculum at the broad end, thick posterior end, and unembryonated. So, this egg can be sometimes confused with what? With Diphyllobotrium. Okay? Pero, what are the characteristic of Paragonimus westermani egg that you can use to differentiate from that of Diphyllobotrium? Ito, meron siyang itong part, thick posterior end. Okay? Thick posterior end. Aside, kasi nga pareho silang may operculum. Pero eto, siya din yung may prominent na shoulder. Okay? So, yan, eto. Para siyang may shoulder. Yan. Okay? So, eto, we have here, Paragonimus westermani eggs. Okay? It sometimes can be confused with Diphyllobotrium eggs because both are operculated and unembryonated and somewhat similar in size. But, yung Diphyllobotrium eggs, okay, meron silang opercular shoulder and thickened shell at the abopercular end. So, that is the difference. Eto, okay, so as you can see here, we have this one, meron siyang shoulder. Okay? Opercular shoulder, merong thickening dito, oh, mas makapal. Naging makapal siya at the end. So, this is Paragonimus westermani. Ito, meron din siyang operculum, pero hindi obvious ang kanyang shoulder. Okay? Shoulder is not obvious. No thickening on the end of the egg. So, this is Diphyllobotrium. Okay? How about this one? Meron siyang shoulder. I hope you can see it. There is thickening at the end of the egg. This is Paragonimus. Again, presence of shoulder, presence of thickening, that is Paragonimus. Eto, meron ba siyang shoulder? Wala. That is, meron ba siyang thickening? Wala. Therefore, this is Diphyllo. This is Diphyllo. This is Paragonimus, Paragonimus, Paragonimus. Okay, so this is the life cycle. Okay, that's the life cycle in the external environment. Yung eggs become embryonated. Okay, so as is it pass, as the egg is passed, that is unembryonated. Pero kapag napunta siya sa environment, it becomes embryonated. May residia hatch and penetrate a snail. So penetrate a snail, first intermediate host. And then, nagkakaroon siya ng sporocyst, regia, cercariae. Okay? Cercariae invade crustaceans. Second intermediate host niya, crustaceans. And insist into metacercariae. Human ingest inadequately cooked or pickled crustaceans containing metacercariae. Okay? So, yan. Inadequately cooked or picked crustaceans. Okay, that's why I'm really not fine when you're teaching this one, this subject, clinical parasitology. Okay, it will give you a lot of doubts when eating raw foods. Okay, that's why I don't eat sushi, mga ganyan, yung mga hindi naluto kasi I'm really afraid. Diba? Di bali nang hindi ko siya matikman, huwag lang ako magkaroon ng parasite na mga ganito or yung mga kilawin, oyster. I'm really not also, kasi natatakot ako. Anyway, so this is what, yun nga, humans ingest inadequately cooked or picked crustaceans containing the metacercariae. It exists in the duodenum. Adults in cystic cavities in lungs lay eggs. So, from duodenum, that will migrate, pupunta siya ng lungs, which are excreted in sputum. That's why yun nga yung sample. Alternately, eggs are swallowed and are passed in the stool. So, kapag nasa swallow mo yung egg inside of you, yun nga, magpapakita din siya sa stool. Okay? So, again, Paragonimus westermani, it can be confused with tuberculosis infection. Okay, so again, infective stage, eto naiiba, that is metacercaria. So again, what is the definitive host? Human. Okay, reservoir host, mga carnivores, mga animals that are carnivores. Habitat niya is lung. Okay, habitat is lung, yung lungs. Intermediate host niya, of course, first ay snail. Okay, so wag nyo na alamin kung anong type of snail. Hayaan nyo na yan, basta snail. Ang second is crustacean. Ano yung mga crustacean, crabs, crayfish, mga ganyan. Okay, kaya yung nauna doon ang nilagay ko is crab, di ba? Yung second intermediate host for Paragonimus crabs. Pero usually mga crustaceans. Okay? Sundatel pusa, Philippines. So, wag na. Never mind. Basta alam niyo, first intermediate host, snail, second intermediate host, crustaceans, crabs. Okay, infective stage again, metacercariae. Mode of transmission, ingestion of crustaceans containing metacercariae or infected crustaceans, or ingesting undercooked or raw infected crustaceans. Okay? So, nagkakaroon of possibility of ectopic parasitism. That's why yung habitat nila, it's not only the lungs. Usually, lungs is the habitat. But ectopic parasitism is also possible. Kaya pwede din sa mga ectopic sites like cerebral and abdominal. Eggs discharge with sputum. Okay? Sputum, but these eggs can be further ingested. That's why pwede din siya sa stool. Ang hirap magsulat. Yan, basta stool and sputum. Excuse me. Okay, so let's continue. So this is the first intermediate host. So just remember snail and second intermediate host, crustaceans, usually crab. Okay, mountain crab. Social, no, sundatel pusa, Pilipina. Anyway, pathogenesis termed as paragonomiasis. This is yung usual way of um, saying yung mga infections for parasites, di ba? What do you call this one? Like entamoebiasis or amoebiasis, enterobiasis, paragonomiasis, schistosomiasis, parang siyang may iasis. So, that's already yung kanilang, that's the term for the infection ng mga parasites. That's yung usual. Okay? So, nagkakaroon yung Paragonimus westermani, it provokes granulomatous reaction in the lungs that can lead to the fibrotic encapsulation. Okay? Early stages yan ng infection. Okay? Sa heavy infection, there is dry cough and produce blood stain or rust-colored sputum with foul fish odor. Okay? In the morning. That's why nagkakaroon ng misdiagnosis ng tuberculosis. Kasi yun nga, dry cough, tapos yung cough pa may blood stain. Okay? And if chronic cough is present, it can also be mistaken as chronic bronchitis. Eosinophilia and pleural effusion is mediated by the level of interleukin 5 in the inflammation site. Cerebral involvement is the most serious complication. Okay? So, yan yung pinaka most complicated or most serious complication of Paragonimus westermani infection. And yun nga, worm migration is possible. Kaya pwede niyang ma-reach yung cerebral areas as well as abdominal areas. For clinical types, thoracic, yun nga may chest pain, coughing, blood tinged sputum, or hemoptysis. That's why it can be confused with pulmonary tuberculosis. So, wag kakalimutan yun. This one, in case sa lung siya, it's the lung fluke. Okay? It can be yung infection with this lung fluke, since it affects the lung, it can be confused with tuberculosis. Abdominal, okay, hepatic type, possible hepatomegaly or enlargement of the liver. Cranial type, if there is also migration of the adult worm sa mga cerebral areas, so nagkakaroon ng dizziness, headache, as well as epilepsy. musculocutaneous type is migratable subskin nodule. Okay, so laboratory diagnosis, of course, these are by the clinicians, disease history and physical exam, detection of egg in sputum or feces, abscesses or pleural effusions. And pag pleural, this is yung effusions in the lung. Okay, lung cavity. Immunological diagnosis for ectopic, radiograph, intradermal test, complement fixation, and the EIA. Okay? Treatment, ganun din, just like schistosoma, it's praziquantel. Okay, prevention, hygienic education, social construction, economic refinement, as well as adequate cooking of crustaceans, particularly yung ating crabs, mountain crabs. So, liver flukes. Okay? So, ito is COFA. Okay? It's COFA. COOF. Okay? So, para lang, maglagay na kayo na dyan ng E for you to easily remember it kasi wala namang word na cough. Diba? So, COFA na lang. Okay? So, clonorchis, liver flukes. So, eto na yung mga liver flukes. Lung fluke natin is Paragonimus. Blood fluke are schistosomiasis species. So, sa liver fluke ay Coppa. Okay? Clonorchis, Opistorchis, and Fasciola. Okay? So, guys, wag yung idadagdag yung ating Fasciolopsis. Okay? So, kahit COF na lang. COF. Coffa. And small letter A. Okay? Kasi same lang naman yung genus, different in species. Clonorchis, Opistorchis, as well as Fasciola. Okay? So, slide 53 na tayo. So, ano na? Kumakalahati na. Okay? Morphology of adult, yun nga, this is general for all trematodes. Flat feet. Flat leaf-like body. Okay? Parang mga dahon-dahon lang. Hindi kagaya ng cestodes. These are tape-like. Okay? Parang tape, scotch tape. Anterior end forms a cephalic cone. Yan. Meron siyang cephalic cone. Guys, eto yung mismong adult worm ha. Hindi pa to yung kanyang egg. Okay? Meron siyang cephalic cone. It has an anterior elongation where oral and ventral sucker is located. Eto yun. Okay? So, ito yung elongation that is being referred to for the oral and the ventral sucker. It has branch cecum. This is the cecum. You cannot see it. Let's change the color into yellow. Diba? Finals ko lang to na-discover. Ganun pa rin here. Okay, but it's here, guys. This one, this is the second part. Branch secum and coiled and short uterus. So here, very short lang daw ang kanyang uterus. Okay, this part. I think the red is still better. Here, okay, so at least you can see it. This one is the coiled and short uterus. Okay, what's the other name for Fasciola hepatica? That is sheep liver fluke. Okay, sheep liver fluke or temperate liver fluke. Okay? Temperate liver fluke pala or tropical liver fluke, yan yung sa Fasciola gigantica pala yun. So, cephalic cone distinguishing feature which has marked widening at the base of the cone. So, eto yun. Eto yung cephalic cone. Eto. You can use this one. This is your reference to differentiate it with other, okay, with Fasciola gigantica. Pero si gigantica kasi it's longer. Okay? Pero ito, it's one of the distinguishing feature or characteristic of Fasciola hepatica as compared to that of Fasciola gigantica. So here again, common characteristic of trematodes that is the presence of operculum. Yan yung operculum that is operculated, large, ovoidal, and operculated. Okay? Yellowish to brownish in color when bile stained and segmented mass of vitelline cell. Okay? So, it's actually, yung mga eggs kasi nila talaga, it's really confusing. Okay? So, it's hard to differentiate eggs ng Fasciola hepatica as well as Fasciola gigantica. Okay? So, we have here yung life cycle, that is the sheep, which is the usual host sheep. Okay? So, it contains, yun nga, as you can see, we have it here. Ito yun, yung kanyang adult. Conical projection or shoulder, ito. Okay? Conical projection or shoulder. So, that will, of course, that will lay eggs. Yung sheep, it will excrete the egg into the environment that hatches within 9 to 15 days. It will release meracidium, which is free living. What do you mean by free living again? Okay? It can live on its own. Okay? Can live on its own. So, kumbaga, this stage of the parasite is non-parasitic. Okay? Kasi it can live on its own nga. It can, free living siya. But this meracidium invades intermediate host, which is what? Okay? Which is the snail. Okay? It invades the snail. So, intramolluscan cycle, Sporcis regia cercariae. And then, cercariae, we have here um, also a free living. Yung cercariae, yun nga pupunta na siya sa, this is fasciola, mga water vegetations. Okay? Mga aquatic, what do you call this one? Aquatic leaves. Okay? Water vegetations. Mga vegetables living in the water area. And the cercariae will what? Will become metacercariae. Okay? So, human eats watercress with encysted metacercariae. So, di ba usually pag yung mga ganitong vegetables, sometimes these are served as undercooked or raw. Okay? So, yung human here are actually accidental hosts. Again, what is the infective cycle? It's infective stage that is encysted metacercariae or just metacercariae. Okay? Which is the encysted form ng cercariae. Ang tawag dun is metacercariae. So, the usual life cycle is that the sheep will ingest or feed on this infected watercress. Okay? Or water vegetation. But yung humans, since we are also consuming mga watercress or water vegetations, okay, we can be accidental host. Okay? Metacercariae exists in the duodenum, pass through intestinal wall, peritoneal cavity, liver capsule, liver substance to reach biliary passage to mature. So, it's usually yun nga yung sa liver, kaya nga siya kasama sa liver fluke. Okay? So, this is for fasciola hepatica. Fasciola hepatica, sheep. Okay? Sheep liver fluke. Okay, so that's the usual life cycle. So, wag niyo nang memorize itong mga to, Cercariae, Media, Miracidia. As long as you know on the major important things that happens in the life cycle of the parasite. Okay, so we have here, this is the egg for Fasciola hepatica, Miracidia, and the Cercariae. If we compare yung Cercariae, it's not fork shape. Okay, iisa lang, para lang siyang sperm. Okay, so yan. That is the cercariae for fasciola hepatica. But then again, we do not usually see this type of structure in the laboratory kasi hindi naman to yung nakukuha natin from the human, from clinical samples. Okay, it's usually yung egg na. So, fasciola hepatica habitat, that is the proximal bile ducts. Okay, definitive host, human, sheep, or cattle. So anyone that can or that ingest watercress, water vegetation, vegetables, mga ganyan. Okay, intermediate host, that is first snail. Okay, second aquatic plants. Aquatic plants, mga watercress, and vegetable leaf blades. Infective stage, encysted metacercariae on blades of aquatic plants or freshwater contaminated with encysted metacercariae. Mode of transmission, of course, ito yung kakainin mo, yung second intermediate host. Eating raw aquatic plants with metacercariae or eating raw sheep liver, which is very unusual naman, di ba? This is very unusual for me. I don't know for you if you are eating raw sheep liver. Okay? But the usual mode of transmission is that eating raw infected aquatic plants. Okay? Eating raw or undercooked infected aquatic plants. Okay? So the diagnostic stage is what? Eggs in stool. Large operculated eggs. Okay? Eggs in stool treatment. By Thional, that is the drug of choice. Of course, what's the prevention? Do not eat raw, okay, or undercooked aquatic vegetable. Or do not eat raw or undercooked sheep liver. Yung ganun lang. So, that's the usual thing, right? So, iiwasan mo lang yung mga ganun kapag kung ano yung mode of transmission niya, iiwasan mo lang. Pwede ka naman kumain ng mga watercress, water vegetation if you cook them well. Okay? If you want to avoid infection with Fasciola hepatica. Fascioliasis, another term for that is liver rot. Presence of worm in the biliary duct cause inflammations in the right upper quadrant. So, there will be right upper quadrant pain and fever. Thickening of biliary walls that cause fibrosis, hepatomegaly, and liver cirrhosis. Fascioliasis that is mostly asymptomatic. Obstruction of biliary tract if it's prolonged infection. And sometimes the adult worm gets into the blood circulation causing abscesses and general toxemia. Okay, Halzone, that is a term, disease caused by the adult worm in raw sheep liver which adheres to posterior pharyngeal walls and causes painful pharyngitis or asphyxiation. This can be removed surgically. Okay, so fasciola gigantica. Okay, as you can see here, it is longer, di ba? It's longer and aside longer, larger, and eto, yung part na to, okay? So, balikan natin yung ating fasciola hepatica. So, it's here. Presence of prominent cephalic cone dito. And this is shorter. Okay, yung isa is larger. Yan, this is 1 cm. Yung sa hepatica is millimeter, only parang 3 millimeter. This is more than 1 cm. Okay? So, larger, more lanceolate, okay, pahaba, yun yung ibig niya sabihin, mas pahaba siya kasi yung kanina, di ba, is shorter, okay? Ito naman, it is more lanceolate with less developed shoulder. It has less or shorter cephalic cone. Ito, shorter daw ang kanyang cephalic cone. And it has more branch ceca and ovary. Diba? If you notice, if you look at the structure closely, mas branch ang kanyang ovary and structure and mas mahaba siya. If we compare it to the hepatica, yan o, konti lang yung branches and this is a lot shorter pero mas prominent ang kanyang cephalic cone. So that is the adult form of Fasciola gigantica. Gigantic, mas malaki, mas giant, kumbaga. Okay? So don't forget that one. This one, it's parang same. It's larger but very similar to Fasciola hepatica ova. That's why in the reporting, okay, presence of Fasciola ova. Okay, you cannot specify yung species up to the species level because structurally the same. Okay, except sa size. Parang pareho lang sila. So, Fasciola hepatica. Or, I mean, Fasciola ova. Okay, kagaya ng Taenia, right? Taenia species. Okay, ano pa yung halos pareho? Yung Entamoeba histolytica, Entamoeba dispar. Diba? Entamoeba histolytica, Entamoeba dispar. So, yung mga yan. So, we have it here. As you can see, hopefully, you can see this well, more prominent and shorter. Okay, the gigantica that is larger, longer, but lesser prominent yung kanyang shoulder. Okay, lesser prominent yung shoulder. Cephalic cone, dito meron siyang, eto guys, so eto yung shoulder. Yan. Yan yung sinasabing shoulder. Ito is more on pahaba kasi siya na type. Okay, two shoulders, converging margins, simple medial branches, smaller in size. Ito more branch, more branched but less prominent shoulders and longer. Okay, that is for the gigantica. How about here? Okay, baliktad. Siyempre, ito mas mahaba. This is, ito mas prominent. Oh, okay, this is for the hepatica, longer, larger, that is the gigantica. Okay, so there is also presence of acetabulum, gonopore, oral cone. So, eto, this is for the gigantica. Liver flux structure. So, we have here yung sa, this is gigantica, it's the same. It's the same, guys. Yung nga infection is ingestion of raw, undercooked, infected watercress or water vegetation. Okay? So, ganun din. Ganun din siya. Definitive host, sheep, cow, humans. Okay? So, same lang din. May Cercaria, may Regia. Yung snail, same lang din, Fasciola gigantica. Snail is the first intermediate host, and water plant vegetation is the second intermediate host. So, habitat, bile ducts. Okay, so bile ducts. Saan ba kasi yung bile duct? Siyempre sa liver. Malapit sa liver. Definitive host, ganun din human, sheep, cattle. Freshwater snail, first intermediate host. Pareho lang din, hepatica and gigantica. Second is aquatic plants and vegetable leaf blades. Okay, infective stage, metacercariae, eating raw aquatic plants with metacercariae or eating raw ship liver. So it's the same. Life cycle for gigantica and hepatica is the same. So yun na lang yung tatandaan nyo. Ganun din, this bithionol, this is the drug of choice. Okay, so yung triclabendazole, also a recommended drug of choice because of efficacy and safety purposes. Okay. So, tapos na tayo sa ano na yun? Sa F, na huli, yung huli, di ba? Coffa, we're done with the fasciolas. We go to Clonorchis and Opistorchis. So, they have the same life cycle with fasciola. Mode of transmission is ingestion of raw or undercooked fish. Okay. So, for both pala, no. For Fasciola hepatica, that is, hepatica and gigantica, ingestion of raw or undercooked infected water vegetation. For Clonorchis and Opistorchis is that the mode of transmission is ingestion of raw or undercooked fish. Okay, it's fish naman ngayon. Kanina plants, ngayon fish naman for Clonorchis and Opistorchis. Okay, so Kofa. Kof. Fasciola, this is, okay, plants. Lagyan nyo lang ng ganyan, plants. Kofa, kof, yung F doon, lagyan ng line, plants. Water plants, water vegetable, watercress. Yung C and O, Clonorchis and Opistorchis, okay, eto ay fish naman na. Okay, infected fish. Ano yung nag-infect sa fish? Metacercariae. Okay? So, Clonorchis parasite of man, dogs, and cats. Bakit kaya? Bakit? Because man, dogs, and cats eat fish. Okay? They eat fish. Lalo-lalo na si dogs and cats kung nakakain sila ng undercooked or raw. Okay? Pero si man din kasi kumakain. Meron ngang kilawin sa mga Ilocano, di ba? So, this is common in Korea, China, and Japan. This is parasite of the biliary passage. Kaya kasama siya sa liver fluke. Okay, liver fluke, Clonorchis, Opistorchis, Fasciola. Okay, morphology of the adult worm, syempre, flat pa rin. Flat but elongated. So, mahaba na rin siya. Monoecious. Okay, all of the trematodes, except schistosoma, these are hermaphrodite. Yun yung ibig sabihin ng monoecious. It is capable of self-fertilization, meron siyang ovary, meron siyang testes. With two suckers, okay, di ba kapag trematodes, dalawa, kapag cestodes, apat. Characteristic feature is branched testes in the posterior third of the body and a relatively small ovary before them. Okay? Branch testes. So, eto. This is the branch testis. Okay? So, posterior third of the body, kumbaga yung testis niya, yun na yung sa baba. Okay? And presence of ovary before them. Bottleneck appearance. Bottleneck appearance. Okay? Meron siyang bottleneck appearance. So, etong part na to, okay, para siyang yung Pop Cola before. Can you remember it? Though I think it's phased out already, yung Pop Cola. Okay? Siyempre ng mga kabataan natin. Di ba yung parang straight na ano lang, medyo nag-slant lang siya ng konti. Okay, sa upper portion. Yung Coca-Cola kasi medyo mas sexy na siya may ganyan. Pero yung Pop Cola before, straight lang siya na ganyan. Okay? So, it's not perfect. Sorry. Yung drawing ni ma'am. Pero yun nga, bottleneck appearance. Testis is found on the end. Okay? Third body part or yung parang end na ng worm. Okay? So, that is for Clonorchis. So, yung Clonorchis egg, meron din siyang operculum. That's why it's operculated. Pero pansinin nyo, meron din siyang, parang meron siyang lobe. Okay? So, yan, oh. Yan. Tapos, very prominent yung kanyang operculum. Clonorchis sinensis egg, operculated. Very prominent yung operculum. Okay? The operculum at the smaller end of the egg is convex and rests on a visible shoulder. So, yan, napapansin, very visible ang kanyang shoulder. At the opposite, larger abopercular end, a small knob or hook-like protrusion. Yan yung hina-highlight ko. Okay, eto yun. Yan, meron siyang protrusion. That is Clonorchis. Okay? And the myrcedium is visible inside the egg. Hindi masyadong pansin dito. Okay, pero yun na. Okay, operculum. Yung egg niya is ganyan and meron siyang hook-like protrusion. Okay? Sa end. So, that is Clonorchis. Okay? So, yung difference niya dito as compared kay Fasciola hepatica is that, yun nga, ang second intermediate host na niya dito is fish. Okay? And if this fish is undercooked, it's infected, and that is consumed by human, dog, and cat, they can also be infected. So, eto pansinin nyo guys, bottleneck appearance na pahaba. Adults in biliary duct, embryonated eggs are passed in the feces. Okay, embryonated eggs are passed in the feces. So again, first intermediate host, snail. Second intermediate host ay fishes. Life cycle, a model pattern of trematode. Why? Main points, definitive host is human being. Reservoir host din. Dito na kasi ang reservoir host ay dogs and cats. Okay? So, dogs and cats. Ang habitat, syempre, hepatic bile duct. Hepatic, kaya nga sila liver fluke. Hepatic bile duct and discharge of eggs in the feces. Okay? Discharge of eggs in the feces of the infected individual. Life cycle, hatching in the host, small intestine. To intermediate host, yung sa snail. Okay, hayaan nyo na to guys. Wag na. Okay, wag na rin yung mga species. Second intermediate host ay freshwater fishes. So, merong asexual proliferation, infective stage, metacercaria in fish. Pag fasciola, metacercariae. Okay? Pareho silang metacercariae, pero iba yung source. Pag Clonorchis and Opistorchis sa fish. Kapag fasciola, sa watercress vegetation. Mode of transmission, ingestion of metacercariae present in the infective fish. So, this is sa Opistorchis naman, sinensis and Philoneus. Of Clonorchis, Clonorchis sinensis, Clonorchis sinensis. And ito naman yung sa Opistorchis. Okay, so pathogenesis worm, mechanical stimulation, peripheral inflammatory reaction in biliary epithelium. The wall of the bile duct thickened, fibrous tissue around the bile duct and worm obstruction cause cholestasis. When bacterial infection occur, it causes cholecystitis, sometimes cholelithiasis happens. So, intrahepatic bile duct expansion, kasi nga dun sila nakatira. Okay? Enlargement of liver, necrosis of liver tissue. Okay, continuous severe infection of clonorchis may result to liver cirrhosis. Persistent cholestasis cause biliary liver cirrhosis, and it is associated with cholangiocarcinoma and hepatic carcinoma. So guys, take note, okay? Clonorchis sinensis can lead to what? Persistent chronic infection can lead to cancer formation. Okay? Cancer, clonorchis cancer. It associate with cholangiocarcinoma and hepatic carcinoma. Okay? So pwede siyang mag-develop into cancer. Okay? So clinical manifestation, allergic reaction. So yan, chronic stage functional impairment of liver. Kasi nga sa liver siya nag-i-stay, advanced stage portal cirrhosis, and yun nga, pwedeng mag-result into malignancy. Okay? It is capable of initiating cancer. Okay? So actually, it's not only clonorchis. So yung dalawang nakukuha sa fish, clonorchis and opistorchis, they can contribute to cancer formation. Okay? Pathogenic treatment, praziquantel, ang drug of choice. Okay, heteropathy treatment, control of the source of infection. Treat the patients and domestic animals, cats and dogs. At the same time, fish should be cooked well. Okay? Kaya really try to avoid yung mga raw, undercooked na fish. Sewage must be treated before disposal. Bakit kaya? Okay, kasi nandun yung mga tae-tae, and what if that is infected? If that is infected, napunta siya sa water bodies, napunta to sa snail, na-infect yung snail, okay, magre-release ng miracidium na pupunta sa fish. Okay, and the life cycle continues. So yun, we move to Apisturchus falaneus. It has lobate testes and are arranged obliquely, reddish-brown lancet shape. Coffee shape, coffee bean appearance, that is Paragonimus. Okay? So, isipin nyo na lang, masarap amuyin yung kape. Siyempre, if that is inhalation, ano yung involved na organ? Lungs. Okay? Masarap amuyin yung kape, coffee, coffee bean-like structure, lungs, Paragonimus. Okay? So, si Opistorchis, it resembles Clonorchis, but it is narrower and has more tapering ends, pointed terminal knob, and less conspicuous operculum. Okay? So, what's the other name for Opistorchis? Felaneus, feline. So, ang sinunod ko, feline, Felaneus, cat liver fluke. Okay? Cat liver fluke. So, this is si Opistorchis. Ganun din para siyang bottleneck appearance na. Okay? Pero, if we look at the structure, balikan natin yung structure niya, guys. Yung sa testes. Eto, guys. Yan o. Yung testes niya nasa end part. Okay? Sana dun hindi. Okay? Dito, hindi. Okay? Dito, hindi. As you can see, makikita dito, saan yung branching ito, oh. Okay? Sa gitna. Okay? Nasa gitna yung branching. I don't know if these are ovaries. Okay? So, eto meron siyang excretory bladder. So, this is opistorchis. Si Clonorchis, yung testes niya nandito na part. Si Clonorchis, hindi. Nandito sa taas na part. But yung egg, it's like the same. Parang siyang same lang, no? Yung Opistorchis and Clonorchis. So, habitat, distal bile ducts. Okay? So, bile ducts, usually, si Clonorchis, Opistorchis, fasciola, sa mga bile duct sila. Ang hepatic bile duct. Intermediate host, ganun pa rin. Siyempre, snail. And ganun din, same with Clonorchis. Ang second intermediate host is water. Okay, definitive host, ganun din, kagaya ni Clonorchis, human, cats, and dogs. Okay, paulit-ulit tayo sa infective stage, same. So again, this part is the same with Clonorchis. Okay? So, Pistorchis, pathology, inflammatory and proliferative changes of biliary epithelium kasi doon nga sila nagre-reside. So, yun din yung maapektuhan. fibrosis of the distal biliary vessel. Pathologic changes may extend to the proximal bile ducts and the gallbladder. Light infection, asymptomatic, enlargement of liver, passage congestion of spleen, icterus, eosinophilia, yun nga, di ba? Eosinophils, this is also increase in some parasitic infection. Heavy infection invades the pancreas, so meron ng invasion of nearby organs. Bile stone may form around eggs as nuclei and cause cholecystitis, loss of appetite as patient become toxic. So, again, clonorchis and opistorchis, sila yung may associated sa cancer. Okay? Especially yung na-mention yung sa clonorchis is that persistent infection that can lead to cholangiocarcinoma. Okay? Or yun nga, malignant cancer. So, laboratory diagnosis findings the characteristic egg in the feces or biliary drainage or the duodenal aspiration. Ganun din, same with clonorchis. The treatment is praziquantel. So, prevention and control. Siyempre, sa fish, iluto mo na lang ng maayos yung fish. Okay? Humans and animal feces should not be disposed in water bodies. Kasi nga yung feces, if the human is infected with opistorchis and clonorchis, the embryonated egg are found in the feces, and then those can be what? It can hatch, okay, it can go to snail, okay, and the life cycle of opistorchis and clonorchis continues. Okay, malapit na tayo. So, intestinal flukes naman ay si Fasciolopsis busci or buscae and the Echinostoma elocanum. Okay? And then the heterophyid flukes are Heterophagus, and the Metagonimus yokogawai. Okay? Fasciolopsis busci. And then, dun tayo sa intestinal, okay? So, si Fasciolopsis busci, siya yung mabilog-bilog. Okay, if papansinin natin, if you look at the characteristic structure of the adult worm is that, of course, there are oral and ventral sucker, meron siyang unbranched cecum, okay, branch ovary, branch testes, but siya yung ovoidal, yung as in bilog na walang shoulder, walang cephalic cone. Ano na ulit yung may mga cephalic cone? Si hepatica and si gigantica. Okay? Yung parang meron silang shoulder. Dito, Fasciolopsis busci, wala. Si Clonorchis and Opistorchis, Clonorchis yung bottleneck appearance na yung testes niya obvious sa end part, sa third part ng kanyang body. Si Opistorchis naman is para din siyang bottleneck appearance, pero parang walang laman masyado yung kanyang end part ito. Okay? Parang ito lang yung meron siya, yung dalawang parang itlog na part. Okay? So, si Fasciolopsis busci yun nga, mabilog siya, hindi siya bottleneck appearance, wala rin siyang shoulder. Okay? So, for the ova characteristic, di ba, parang hindi ganun ka-obvious yung kanyang operculum, but yung kanyang eggshell is very thin. Thin eggshell. Okay, thin eggshell, yellowish, minute operculum, hindi napapansin masyado dito yung kanyang operculum kasi nga maliit lang. Okay? Egg cell inclusion, Fasciolopsis buscae eggs are released in feces unembryonated. Okay? Unembryonated. The operculated eggs are oval brown in structure. Malaki, thin shell egg, not obvious ang kanyang operculum. Okay, so we have it here. Ganun din. Okay? So, for this is already Fasciolopsis buscae. So, this one, adult in small intestine. So, we have it here. Unembryonated eggs are passed in the feces, not only humans, but as well as pigs. Okay? So, embryonated eggs in water, it embryonates in water. Miracidia has invades snail. Okay? And then, of course, yung still mag-release na siya ng free living cercariae, Metacercariae on water plant ingested by humans or pigs, causing infection. So it's usually same siya, yung mga F, Fasciola hepatica, Fasciola gigantica, Fasciolopsis busci. Pero guys, take note, si Fasciolopsis busci is an intestinal fluke. Fasciola hepatica and gigantica are liver fluke. Okay? Pero same, ganun din Metacercariae on water plant ingested by humans or pigs, causing infection. Okay? So, dito, yung sa Pachyolopsis busci, humans and pigs, saan nakukuha? Kagaya ng F, Fasciola hepatica and gigantica, sa water vegetation. Okay? Water plant. Sa water plant din nakukuha. Okay? So, definitive host, human, pigs, and dogs. Intermediate host, first is snail. Second, intermediate host, aquatic plant vectors. Habitat, small intestine, infective stage, Metacercariae. Mode of transmission, kagaya din ng fasciola. Okay? So, ingestion of encysted Metacercariae on aquatic plants. Yung pagkakaiba nila is that it resides sa small intestine. Laboratory diagnosis, examination of egg and feces by sedimentation method. Drug of choice, ganun din. Praziquantel. Okay? Ito medyo nakakaiba. Okay? Ito yung medyo naiiba because of this structure. Okay? Adult morphology, reddish-gray. So, the horse-shaped collar of spines. So, circumoral disc around the oral sucker. So, ito yung kakaiba. And pansinin nyo yung name din niya is kakaiba. Echinostoma elocanum. Okay? Echinostoma elocanum. So, nakakaaliw mag-highlight. Okay? So, that is horse-shaped collar spines. Again, horse-shaped collar spines, kakaiba. Echinostoma elocanum. Okay? Ilocano. Subsabality Ilocano. Siya yung may horse-shaped collar spines. Okay? It has also simple intestinal ceca. So, this one is the Echinostoma elocanum. So, you can also, pansinin nyo yung kanyang testes. Okay? Pansinin nyo yung kanyang testes. Okay? On a straight line. Okay? Straight line yung testes ni Echinostoma elocanum. Hindi lang kasi masyadong obvious yung kanyang horse-shaped collar spines. Okay? So, balikan natin yung iba. Okay? So, eto, I think this is testis. Okay? Testes ng Opistorchis. So, eto yung kanyang testes. Hindi siya kasi na, what you call this one, hindi siya na-highlight, hindi siya na-label. Pero I think eto yung kanyang testes. Hindi eto. Okay, it's not. This is not the testes. It's here. Eto. So, as compared kay Echinostoma elocanum, si Echinostoma elocanum, that is on ano siya, parallel sa iisang ano, or on same ano lang, same line. Hindi kagaya ng Opistorchis magkaiba, okay? The left and the right. It's so bright. Charot, okay? Pero yung kay, so binibigyan ko na kayo ng idea. Sa Clonorchis, eto pansinin nyo, si Clonorchis, eto yung kanyang testes. Tama ba? Clonorchis. Oh, eto ang kanyang testes. Iba yung kanyang testes. Okay, branch testes. Okay? Yun yung sa Clonorchis. It is found on the third end, parang pang 3/4 end ng kanyang body. Eto, tama. Eto yung testes ng Opistorchis. Okay? Hindi siya on same line. Okay? Yung kay Echinostoma naman, yun kasi yung pwede nyong pansinin when you want to differentiate or identify. Ito, same line siya. Okay? Same line. Okay? And the presence, yun nga, of horse-shaped collar spines. Ito yung anterior part or dito na part. Okay? Daw, sabi ng aking anak. So, malapit na guys. Ova characteristic, straw-colored, operculated, ovoidal. Okay? Meron siyang knob here. Okay? Meron siyang knob. Ito yung kanyang operculum pero it's not so obvious. Okay? So, ganun din like si Fasciolopsis buscae, small intestine. Okay, another review. Blood fluke nasa small intestine. Sino yon? Nagre-reside siya sa veins ng small intestine. Sino na yon? Siya din yung may maliit, di ba? Si Japan. Okay? So, definitive host, human, dogs, cats, rats, and pigs. So, first intermediate host, wag ka na mag-isip, snail. Second intermediate host, snail din. Okay? Mga Ilocano talaga kakaiba. Why? Presence of horse-shaped collar spines. Aside from that, mga Ilocano mahihilig sa suso. Okay? Sa snail. So, yung first intermediate host niya is snail, yung second intermediate host din niya ay snail din. Okay, infective stage, insisted metacercaria. Siyempre, yung mode of transmission niya is that ingestion of contaminated snail. Okay? So yun, snail, horseshoe shape, one line ang kanyang testis. Same line. Okay? Yan. Pathogenesis, inflammation at the site of attachment ng adult worms, ulceration, bloody diarrhea. Okay, siya yung kakaiba, may possibility ng bloody diarrhea kasi nga saan siya? Sa small intestine ang kanyang, what do you call this one, location. Detection of eggs in stool, treatment, praxicantel, prevention and control, avoid ingestion of improperly or raw, undercooked snail. Okay? So, this is for heterophies. Elongated oval piriform tegument, fine scale-like spines, variously arranged testes. Napakagulo. Yun na lang yung isipin nyo. Globular and slightly lobed ovaries, smallest trematode. Siya daw po ang smallest trematode. Maliit din sino na yun? Fasciola hepatica, pero 3 mm kasi siya. Okay? So, eto siya yung smallest heterophies na may napakagulong testes, variously arranged testes. Okay? So, eto, light brown in color, ovoid, operculated, fully developed merocidium is present. But as you can see, parang wala siyang castra structure internally. Okay? So, this is for heterophies. So, yun ang kanyang life cycle. Okay? So, this is skin, brackish. Okay. So, yes. So, pareho siya. Heterophies is fish din. Pareho siya ni Clonorchis at Opistorchis. Undercooked fish containing metacercariae. Okay? Mga F, Fasciola hepatica, Gigantica, Fasciolopsis, watercress, vegetation. Okay? Clonorchis, Opistorchis, heterophies, fish. Echinostoma elocanum, snail. Siya yung kakaiba. Okay? So, ganun din. As you can see dito, parang wala siyang structure sa anterior part, pero ang gulo-gulo ng kanyang structure on the end part. Ito, di ba? Malinis sa taas. Yan yung heterophies. Malinis sa taas, ang gulo-gulo sa baba. Okay? So, last. Okay, habitat small intestine. Human, cat, dog, and fish. Freshwater fish, kagaya ng Clonorchis, Opistorchis, and yun, heterophies. Diagnostic stage, eggs in stool. Infective stage, metacercariae. Prazicantel, ganun din. Eating raw or undercooked fish is the mode of transmission. Metacercariae is the infective stage. So, heterophiasis, that is the presence of flukes in human intestine, initiate intestinal mucosa inflammation. Most of patients are asymptomatic. If symptoms appear, merong abdominal pain and non-bloody diarrhea. So, eto naman yung sa Metagonimus yucogawai. Okay? So, eto yung kanyang structure. Ganun din malinis sa taas na structure, pero dito is parang mas malinis siya. Okay, as compared sa napakagulong heterophies. So, that ends our discussion with trematodes. I hope naintindihan nyo. It's easy naman, di ba? Madali naman siya intindihin. Okay, halos same lang. So, classify nyo lang. Okay? So, yung laboratory part is mostly on pictures.